The Avance Solo Negative Pressure Wound Therapy System is designed to deliver negative pressure therapy for up to 14 days. The following animation is a brief guide to the setup and use of the system. Start by attaching the canister to the bottom of the pump. To do this, align the opening in the top of the canister with the spigot projecting from the bottom of the pump. Once aligned, push together and then secure the canister tubing by pushing into the pinch clamp at the back of the pump. Next, turn the pump over and remove the battery compartment door by sliding up. Insert 2 of the AA batteries supplied with the system, paying attention to the correct orientation of the battery terminals. Now, replace the battery compartment door. When the batteries are inserted correctly, the pump performs an automatic self-check. In self-test mode, the pump activates for a short period. All light indicators flash in turn, and the pump will emit audible notifications, first in medium frequency, followed by high frequency. This completes the self-test. After self-test is completed, the pump will remain paused until started. Next, before applying the dressing, cleanse the wound and surrounding skin, taking care to dry the skin around the wound. Now, remove the release film from the dressing, starting with the centerpiece. Once removed, orientate the dressing over the wound and apply. You can now remove the remaining 2 pieces of release film, taking care to smooth out creases or wrinkles. Connect the dressing tubing to the canister tubing by coupling the green connectors. They will only fit in one orientation. Check to ensure the 2 clamps are not clamped. To start therapy, press the green button and hold for 2 seconds. You will now hear the pump activate and see the lights in the Start/Pause button flash in unison. You can also observe the dressing contracting as the vacuum is established. The film dressing will have a slightly wrinkled appearance and feel firm to the touch once a vacuum seal is achieved. If a leak exists at application and negative pressure cannot be established, the device will activate an audible leakage alarm and the light indicator for air leakage will flash once every second. The pump will go into pause mode. If this occurs, adjust the dressing, paying attention to removing any wrinkles in dressing border before restarting the pump. Once a vacuum is achieved and during normal operation, the green button will flash 2 times every minute, indicating the system is working normally. Now is the time to apply the film fixation strips provided with the dressing to help to secure against leaks. When managing a deeper wound, it may be necessary to use a filler, an Avance Solo foam. Keeping a distance from the wound to ensure no fragments can fall into the wound. Cut the foam to the shape of the wound such that it will fit into the cavity without overlapping the skin surrounding the wound. Place the foam into the wound and then cover with a dressing. Connect to the pump and then commence therapy as previously shown. To change the canister, first pause the pump by pushing on the green button for 2 seconds. The pump will emit 2 short audible notifications to confirm it is in pause mode. The audible notifications are repeated every 15 minutes as long as the therapy is paused. Next, slide the tubing clamps up close to the green connectors and then push both clamps across the tubing. This will minimize the potential for fluid leakage from the tubing when you disconnect the 2 tubes. You may now remove the canister. First, remove the tubing from the pinch clamp. Next, depress the clear plastic tabs on either side of the pump and pull while gently rocking to release the canister. Once the tabs clear the pump housing, the canister will disengage. Dispose of the canister in clinical waste or as regulated in your care setting. To replace the canister, you repeat the steps at the beginning of this animation, making certain you secure the tubing in the pinch clamp at the back of the pump. Couple the 2 green connectors. Unclasp the 2 tubing clamps and restart the pump. Finally, to ensure the delivery of safe, effective negative pressure therapy, the Avance Solo pump has 3 audio-visual alarms for leakage, low battery, and blockage conditions. If you experience a blockage or leak alarm event, the system will issue an audible alarm and the associated alarm symbol will illuminate. The pump will go into a paused state. The device continues to run while a low battery alarm is active. For further information, please refer to the printed instructions provided with your Avance Solo negative pressure wound therapy system.